Hi, everyone. Welcome back. My name is Amanda Gold, and today I'm joined by Karen Knight, a social worker here at Intermountain Healthcare, Michelle Searle, school principal for Primary Children's Day Treatment Program, and Amy Rosello, an occupational therapist here at Intermountain Healthcare. We're going to be speaking to you a little bit about Primary Children's Child and Adolescent Behavioral Health Day Treatment Program. It's available here in Utah, and it's a great program that we want to talk a little bit more about. So Karen, let's start with you. I'll have you introduce yourselves and tell us a little bit about what you do with this program and how this came to be.
Hi, I'm Karen Knight. I am a mental health therapist, and I also am the behavioral health specialist and psych tech coordinator for our program. So I work with the frontline staff who work day to day with the patients all throughout the day. We work on helping them learn to be more therapeutic in how they approach the patients, how they can help support them throughout the day, and practice good skills while they're in our program, and then hopefully transition in the evenings and out into the community. Our program is Primary Children's Hospital Behavioral Health Day program. We treat children and adolescents age range between 6 and 18. We serve patients who come into our program who are struggling in the outpatient setting, or what we'd refer to as home, school, maybe in their outpatient clinic where they see a therapist 1 hour a week. It doesn't seem to be enough support for them. Or maybe they've struggled so intensely they've been in a residential care, which is a 24/7 facility for several days, several weeks. Or they could have come from an inpatient psychiatric facility where they're there to stabilize symptoms that fall into suicidality, being a danger to themselves or others, and that's usually a 3 to 5 day period. So they either need to step up or step down to a program like ours to create more stability and support over a more intensive, with a more intensive experience over a longer period of time. So we usually operate between 6 to 8 to 10 weeks, depending on how long sometimes our stakeholders will help support parents and patients in this program, and also depending on really the pacing or the timing of a patient's treatment when they're ready to go.
Thank you. And Michelle, will you introduce yourself and also what you do for the program?
Hi, I'm Michelle Searle. I am Primary Children's Adolescent and Day Treatment Schools Principal or School Administrator. A big part of my job is to manage and lead the school portion of our program day and meet the Utah school standards. We do a lot of working with kids and their educational struggles. We help as a team sort of identify things that are going on in that environment and make recommendations to help them be successful.
Thank you. And Amy, will you introduce yourself to us as well?
I am Amy Rosello, and I'm the occupational therapist here at Wasatch. And I am part of the multidisciplinary team. What I do as an occupational therapist is look at how a kid's everyday jobs, how they're doing with those everyday jobs, and if they're having difficulties with those jobs, what is getting in the way. I do developmental assessments and see, I try to identify the challenges that the kids are having and apply strategies and interventions that would help them with doing their everyday jobs as independent and as comfortably as possible. So some of the common things that I would look at with kids here on the behavioral health in the behavioral health program would be fine motor skills, gross motor skills, sensory skills, and of course their activities of daily living. So again, just how my role would be to see how though they're doing in those jobs and supporting them in their abilities here.
Well, thank you all for being here. We really appreciate it. Karen, I want to go back to you. I know you explained a little bit about what the program is, but will you explain why this program is so important to our community and how this program kind of helps children get back into their normal everyday life?
Yeah, so I think that we find that sometimes children and adolescents have more than just the everyday struggles. Things become prevalent, or what we'd say frequent enough, that they need more intensive support and help. And sometimes teachers and parents and family members and religious support, sometimes that's just not enough. They need a little bit more intensive support from people who are experts in some of these areas and can provide the assessments and the intensity that they need. Having this kind of program, I think it's really great. We are a multidisciplinary team, and so we get to provide a therapeutic experience at an intensive level where patients get to be here and do more family therapy than they would on an outpatient basis. They get to do individual therapy. They get to be in the school setting and have a lot more one-to-one support, very small classes, and Michelle can speak more to that. They get to be assessed and maybe have support from an occupational therapist, a speech and language pathologist. We have expressive therapists. We have an art therapist. We have psychologists next door that can do psychological testing to look at more intensive need for maybe things such as diagnostic clarification or understanding more about supports for parents to get when they leave our program to help support an IOP or a 504. So we're a great resource for kiddos that sometimes do struggle more than the average child or adolescent or student, we would say.
And how long has the program itself been around, Karen, as well, if you know? And you're still on mute, sorry.
We used to be a residential program, and we've been through primary children's probably for, I don't know, Amy and Michelle could maybe correct me, but 20 to 30 years. And we really only just recently in the last 2 years changed from residential to a day treatment setting. And we also now offer intensive outpatient, which we call IOP, which is 3 days a week for 2 hours. So it's been around for a long time, and it's kind of evolved and changed depending on what really the community needs and what we know about research.
That's very cool to hear that it's been able to adapt and kind of change. And speaking of change too, Amy, this question is for you. So in the era of COVID, children and everyone is now required to wear a mask. And a lot of times I know there's specific sensory issues that can happen with children if they're wearing a mask and it's not comfortable for them or they're fussing with it. And I wanted to talk to you about some of the ways that we can help children work through wearing a mask if they're having issues wearing one to begin with.
Yes, so we have had the opportunity to bring kids back to our program kind of earlier than the school systems did, and so we've been kind of experimenting with this. And I always go off what the kids are telling us, what the patients here are saying, and giving us good feedback about what's working and what's not working. So one of the things that we did that was very, very important before the kids returned were one really key thing is to practice wearing a mask at home for extended periods of time, because we know that's what's going to be expected when they return to school. So if a kid's used to wearing a mask 1 or 2 hours, and then now they're going to 4 hours or 6 hours or even 8 hours, that's a significant difference. So practicing for extended periods of time would be really, really critical. Another really important factor would be, or thing to do would be to model as parents. So modeling, making it fun, showing them that when you go out every time you're being a model, and that you're finding what's comfortable and practicing longer periods of time. So modeling is really, really key. I think also being informed, helping a kid understand the whys behind wearing a mask is really, really important. We're not doing it just to torture them, but to do it for, very much a safety reason. And at this point, there's all kinds of kid-friendly videos social stories online that would be really, really valuable for kids to understand the why behind it, because if they understand the why, they'll be more willing and they have more buy-in to do it, right? I think we'll get to this in a bit, but talking about trying different masks and finding, letting them collaborating with kids in that arena where we can look for the things that are most comfortable for them. And I know we're going to talk about that in a minute. And another strategy that I think is important is working with teachers. Here, we have worked with kids and the staff here on how to take mask breaks. And I think that's going to be a new kind of concept for everybody in the education world. But what does that look like in an individual classroom, in the entire school building? So here in our setting, we've built in mask breaks throughout the day based on the kids' developmental age range and what we thought, they would need. And then we've also built in ways for a child to ask for a break, a mask break. So how could they have that planned ahead to work with the teacher on, if I do need a mask break, I'm feeling kind of panicky or really, really uncomfortable. How do I ask for that? And where would I go to do that safely? So making a plan ahead is really important. So all new things in this COVID world, but I think they're important things to think about.
You mentioned that there are lots of different masks available.
Yes.
Why is it so important to find out which mask works best for your child, and what is available? And I have a couple examples I can show. I don't know if you do as well, but let's talk through what's out there for people.
Yeah, I mean, I think it's important to realize, just like clothing, we all have clothing preferences, right? We all have clothes that feel better to us, clothes that are more uncomfortable to us. And why would masks be any different? In fact, mask on our face, because we have a lot of sensory receptors in our face. I think it's a highly sensitive place. So it is important to look at different mask types, and there's a lot of them out there at this point, and find what are the most comfortable for your kiddos. So I did bring some examples. I mean, going from like the traditional kind of medical mask, I would say based on our kids here that have come back to our program, these are probably the least favorable. They're not the most common that I see here. Will they work in a pinch? Yes. For some kids, they do feel like they can breathe a little better than cotton mask. But again, it's something that you have to try with your kids. And I'm talking about little kids and also teenagers. Like we all have preferences for this. So surgical masks are one option. We actually have kind of more cotton masks that are softer on the inside. And one of the things that we've had to do with a lot of our kids here who have sensory issues, which means their sensory systems, their touch systems in their face just are a little bit more sensitive, and can kind of feel things and things feel more uncomfortable than typical. Sometimes we remove the nose piece, actually. So we've had to kind of poke this through, take them out. And for some kids, that's been very effective. Now, it's still important to make sure you have a safe, secure fit around the nose and the mouth when that's done. But for our kids, because this is a pediatric mask, it works very well. And by just removing the metal clip, that's helped kids be able to wear it longer and with less discomfort. So a lot of our kids, I'd say a majority of our kids, wear the cotton mask or the mask that they buy either in stores, online, or have been made. And these are more just the traditional kind of softer cotton with the ear loops. Some kids really like the crease down the middle because they feel like it provides kind of an air pocket within and it's not so pressed against their face. So that's kind of an option for some kids. I know they also will play with ear looping. So you can either have them go traditional, and some people twist the loop once and put it on if they feel like it's not a secure fit. So that's another variation. I think a couple of masks that I think people might not know are out there, but have been very well tolerated by a lot of our patients here, are masks that have kind of a different inner lining than just cotton. So this one we bought at a local sporting goods store, because on the inside it's made kind of more with a athletic kind of spandex lycra kind of feel to it, very, very soft and silky. And for some kids, that's been really, really effective. It also has a little bit more stretch and give. And then these are even more polyester and spandex kind of bungee. And this earpiece has been tolerated well by some of our kids here.
So it sounds like it really, like the material could be very important for the child, and you'll never really know what your child adapts to unless you actually have conversations and be able to put that on, because the second cloth mask you showed with the athletic liner, that's just as effective because it's got the cloth on the outside, but what's actually touching the child is a different material. It sounds like that's what's the important part, is what can they feel, correct?
What can they feel? And like it's a big part of what we do here called collaborative kind of collaborative problem solving with a kiddo, unless you are helping understand, so tell me about this one. How does it feel? What's bothering you? What's not bothering you? We can make our best guess, but we need to get their feedback to help problem solve it with them. Some kids really have a discomfort with having ear straps around their ears. So then you might want to, and if you didn't know that, you're going to keep running into problems. But then if you know that, you can look for maybe a head strap or a neck strap and modify the ears. We've had a couple patients here who just could not tolerate the ear loops. So then we went to a head strap, and that's been very effective.
Well, thank you. And I'm just going to show the head strap one really quick. This is an example of one. These are adjustable. You can choose where you want them. And there's one for below your chin and above your chin. So those are great examples. So Amy, thank you for that. Absolutely. Karen, this question is now for you. What are some ways that parents can help their children understand how their daily life has changed during this pandemic?
Well, I think that it's no surprise to all of us, right, that life has changed. So they've already been experiencing for several months many changes in their routines, what's going on with mom and dad, what's going to be expected of them, even just going out to the store, where they can play, where they can't play. So they've already been exposed to the changes. I think what's important, though, is we talk about how change is constant. Change is inevitable. It's part of life, whether we like it or not. It just is. And I think it's really important to kind of talk about things like that. Sometimes reality is, and we don't have to like it. We don't have to agree with it. And that's where I think we give permission to our children, our teens, to talk about how much they don't like it, how much they may hate it, how much, they don't want to go and wear it, or they feel really uncomfortable, or they don't get to be around their friends. It can be easy for us as adults to want to jump in and feel stressed or worried or fearful. Then what does that mean if that's how you're talking? I think we should take a step back and remember they get to have feelings and thoughts too, just like we do. It's okay to express these emotions. In fact, what we do know is research tells us if you will label your emotion, even just talk about it, it already moves you from a stress response to a more active problem-solving response. So I think that's really helpful to do with our kiddos. I also think that we bring them back and remember there's so many good things about life. Let's also identify the positive things that we get to experience or what has changed. I've talked to parents who have said, we spend more time together than we ever did before. We spend more time talking together. We actually sit at the table because we haven't been able to go and do things that we normally would have, then family members are doing more. So I think we identify all of the positive things that have changed too, and that have brought us back to some really good things about individual, family, social, school. I also think that as we go back, we prepare. So Michelle and Amy have talked a lot, and they're going to continue to talk a lot about how we do need to be talking about it. And not that it needs to be a constant conversation, but a good check-in. How do you feel about this? Do you still feel the same? What do you like? What don't you like? What will you miss? What have you learned by wearing this mask? What's different? So we involve them in the conversations, and we allow them to share and talk more and and kind of help us learn as well. So I think those are a lot of ways that we can really manage or deal with this situation. And also I think that we forget how much children and teens kind of just go about their life. You know, they've got the mask on and they just kind of do. I think adults, we tend to overthink, we tend to worry, we tend to stress. Children are really resilient, teens are resilient. So let's not underestimate how much that they're pretty adaptable and flexible.
Yes, that's very true. I think children, we give them a little less credit than we probably should with what's happening. I know I've talked to other behavioral health specialists about this, and their keyword always is resilience. They can handle a lot more than we think they can. So Michelle, this question is for you. So this program has been back in session since June. So you guys have kind of gotten the ball rolling a little bit sooner than some other traditional school programs. What has the experience been so far for the children to be back, and what precautions are you taking in your individual areas to make sure children are safe?
As Karen kind of mentioned, obviously change is hard, but everyone on campus has really learned to adapt to the way we do things that are different in school over the past couple months. It's new to come to campus and wear a mask and have to sit 6 feet away from your teachers and therapists and peers. Eat lunch in your classroom instead of a lunchroom. But I believe that the kids have really been resilient, as we've said before. They've done well with the change, and it's slowly becoming part of everyone's routine. And I think our day treatment team has done a really great job of instructing the kids on what to do and helping them be successful at meeting all those guidelines. Like Amy has talked about, you know, we give them masks options, and we've taught them how to hand sanitize and when to hand sanitize and when to take your mask off and how to ask to take that mask off and when is a good time to take a break. And we've just a lot of really great supports that we've put in place to help them. We've also, I think, really tried to set an example of we're all in this together, and we're here, we understand, we're here to support you. Even the teachers and therapists and our psych techs on campus, everybody's wearing masks and doing the same things. And so it feels a little bit more like a team here, helping one another, even with our little kiddos. And so I think it's been going pretty well.
Another question I have for you too is, I know that this program is anywhere from around 6 to 10 weeks, like Karen mentioned earlier. If the children are, if it's during actual school periods or school time of the year, how does this program make sure that the children aren't losing any sort of credit for school? So that way, when they go back to the normal classroom, they're not losing anything out. And why is that important that they're still able to gain that credit while they're in this program?
Yeah, so many of our students or patients come into day treatment. They're failing or behind or struggling in school, and we want to be a help for that, not compounding that issue by getting them further behind. So that's why we've made it a priority to have an accredited school, and a major responsibility of being an accredited school is to ensure that each of our patients are on track with their learning and their credits for graduation. We have really great teachers and staff that spend a lot of time helping them catch up on missed credits, staying current with their peers in school. And in some cases, they actually have the opportunity to get ahead in school. As every kid leaves our day treatment program, they have the opportunity to take those credits and that learning with them back to their community school in hopes that we can make more of a seamless transition for them.
Thank you. And speaking of transition, Karen, this question is for you. How are we helping the children in these programs transition back into their everyday life as well?
Well, I think that's one of the great things about our program is even when a patient comes into the program, we're already anticipating what their needs are. We talk early on as a treatment team about what we're going to be anticipating. So it's not just the last 2 weeks or the last week or the last day. It's a process throughout treatment that we're bringing into the treatment team planning to say, what is this kiddo going to need? What things do we need to look at and change? Because things obviously do change and evolve. And so we're just kind of aware of that. So we have lots of access to resources. We look at all the different types of maybe therapies we should be looking at. Is this the best school for the patient to go back to? Should we be looking at educational supports? Should they continue in occupational therapy or in speech and language pathology? What do we take with that psychological testing that we just had done that shows us so much more about what this child needs? So I think, all of those kinds of things, and even, are they going to see a medical provider when they leave? Are they going to continue with family therapy? How much individual therapy should they be doing? So those are a lot of the discussions, the talk, the options we look at as we're going throughout treatment with this patient.
And Karen, another question for you as well. As a parent, what are some ways that you can help identify that your child might need professional help, especially during a time when a lot of our children have spent the last 6 months at home and their behavior might have changed because of that? But how do you kind of know when there's that line that's drawn that says, okay, as a parent, I need to go seek help from someone else for my child?
Well, I think that obviously, like you just said, things have changed. So behaviors are going to surface different maybe with children than adolescents. I think the key factor is to look for prevalence, or what we would say frequency. If something is taking place and it becomes a trend, so it's not just this week, it's the next week and the next week. And we're going 3 weeks in and we're seeing more withdrawn behaviors or sadness or irritability, or let's say that their aggression becomes something that maybe we're a little frightened about or others are mentioning they're frightened about, say even teachers at school. I also think that anytime a teen or a patient or a child says they're feeling really suicidal, they've thought about suicide, they think they may have a plan. Anytime that we're talking about it being a danger to ourselves or others, that's a definite way to move towards probably seeking immediate professional help. I think that it's always a good start to start with your school counselor, talk to your teachers, see what's going on so you're getting more information. Maybe you look to see a therapist and see how things are going. Maybe you get into your pediatrician and talk with them as well. Maybe you access your parents' employee assistance program so that you're seeing a therapist for a brief amount of time. So those are all ways that we could kind of start the process. I don't think a kiddo needs necessarily an immediate day treatment referral, especially if they haven't gone the route of even looking at outpatient options. So those are how I would start first, for sure, is going through the people that are closest to you. And that you have closest, more access to.
Thank you. That's really great information. And I just want to wrap it up by getting your guys' last thoughts on the program and kind of anything else you'd like to tell the community. So Karen, we'll start with you on that one.
Well, I think one thing is I teach the parenting class here with the teenagers, and I think one thing that they've loved to hear and that I even like to hear from them is, let's normalize this. We're all, like you said, we're all in this together. Michelle said that too. Like, this is hard and it's not fun, and it's okay to express that and talk like that. I think we don't want to get into a pattern of thinking we have to have the shoulds and the musts. That can be really hard on us, and it sets us up to maybe fail more than we need to. I also think that adjust your expectations, be flexible, and involve your kids. They really do have a lot of ideas, thoughts, feelings. They can share and give us a lot of information. So let's start with them too. And then, this is hard, but we're in it together and we're going to keep figuring it out. So don't lose hope.
Yes, this is not something that's just happening here. I think that's really important that this is something happening everywhere and that we all, like you said, are in this together. Michelle, any last thoughts from you on the subject as well?
I would just kind of reiterate what Karen pretty much just said. I mean, as an educator and a parent myself, I think we all just need to be a little more flexible and aware and gentle with ourselves and our children. I think if we continue to just remember that just as much as a teacher struggling to wear that mask, so is that kid. Just as much as you don't want to go to the grocery store every day wearing a mask, but we do. And I think, yeah, just remembering that we're all here, we're all doing the best we can with what we've got, and we need to support one another.
And Amy, any last thoughts from you on this?
To just build on resilience and the positive side of things, what I've seen here is kids that you thought would never tolerate wearing masks or the changes in our routine have actually been surprisingly tolerant and really been able to do more than initially expected. So just like all of us, this has been hard for all of us, and we all have this lovely thing of resilience, but also of a sensory phenom, that we all have called habituation. So just like when if you can remember back to the first time you ever wore a watch when you were little and you put it on and you notice it initially, and then now you put a watch on and you never notice it again, right? That's the same thing that actually happens with masks. When you wear a mask and start to wear it longer and longer and longer, you can actually, I don't know if any of you have experienced this, but there have been times where I put my hand up to see if I have it on still, or my goggles on, because it has habituated and I'm not sure like what's on and what's off. Or sometimes I walk out and I'm like, oh, I don't have it on. So there is that going for us, and that we, as neurological beings, we do get used to things, and the mask will get more comfortable, and it can almost become a part of you. Hopefully that doesn't have to continue forever, but that is something that that we can actually explain to our kids. The more you wear it, the more you get used to it. So that's, I guess that is a good side of this.
You bring up a good point about the watch. Now, whenever I don't wear my watch, I feel very strange that I'm not wearing one. So hopefully that does become some sort of a easier thing for children and anyone having to wear a mask. Ladies, thank you so much for joining us today and talking to us about this really important program. If you'd like more information about the Primary Children's Program, you can go to intermountainhealthcare.org/primary children's and look for the behavioral health program. There's a bunch of different information on there about how to get involved, any resources that you may need, and I'll put that link up in the Facebook Live after for everyone as well. For COVID-19, if you would like to get screened or tested, our COVID-19 hotline is still available. You can call that phone number at 844-442-5224. We also have our emotional health relief hotline, which is available for anyone in our community 7 days a week from 10 a.m. to 10 p.m. That phone number is 833-442-2211. Thanks again for joining us, everyone, and we will see you next time.